you would also want to move anything out of the way. So, you know, I do these presentations in schools oftentimes, so move the desks out of the way if there's a lot of desks around, or tables or chairs or something that would maybe, you know, harm them. And then if you're out in public and you don't know this person, you would probably want to see if they have a seizure disorder or epilepsy. And part of the way to see that is to look at their wrist and to see if they're wearing a bracelet, a medic alert, I guess, bracelet. And if they are, then you know that they have epilepsy, and you can just follow these, you know, seizure first aid things that we're talking about. If you're not sure if they have epilepsy or not, you would probably want to call an ambulance, because you wouldn't know if this is their first time seizure or if it's happening for some other reason. Maybe they have diabetes or something, and those would be circumstances where you want to call 911 immediately. So just stay with the person until they're fully aware and help reorient them. Some people come out of it, well, most people come out of a tonic-clonic and they're very confused as to what just happened. It may take them a little bit to regain consciousness, and that's okay. Just stay with them and make sure that they're safe, and just be, you know, be kind to them, because they will probably be pretty shaken up from what just happened. Again, the things that you do not want to do is do not put anything in the person's mouth. I remember I had a friend in 80s, I guess, that had epilepsy, and that was what we were told to do, was to put something in her mouth. Well, times have changed, and they have found that people cannot swallow their tongues, and you probably shouldn't put anything in their mouth. They may bite their tongue, and so they may have blood coming out of their mouth, but that's probably not going to be very pleasant for them. But if you try to put something in their mouth, you know, they could bite your finger off, or you could hurt their jaw, because their jaw is so, you know, tight during a tonic-clonic. So just steer away from that. And then try not to hold them down or restrain them either, and just, you know, let them go through what they need to go through as far as the tonic-clonic goes, and let it resolve itself. Otherwise, again, they're very stiff, and sometimes if you try to hold them down or restrain them, that you could do damage, like you could break a bone or something. And the times that you call 911, I already talked about most of these, but it's, if it's lasting over 5 minutes, for both, actually, the complex partial and the tonic-clonic, if either of them last over 5 minutes, I'd call 911. And then also if the seizure starts to loop, so if they don't quite come out of the first one and then they've gone into another one, you should probably count that as one seizure itself. So then something's probably going amiss, and you should probably just call 911. And then also if someone is injured, like if they fell and hit their head really hard and there's blood coming out, I would definitely call the ambulance. If they're pregnant, have diabetes, or any of those situations, or if they can't resume their breathing normally. Some people with asthma, you may have to give them the inhaler and then they're fine, but if they're not resuming the breathing normally, then I would call 911. One of the things that this slide presentation doesn't go over is what to do for complex partial seizures, and those are the ones where people are walking around aimlessly, maybe picking at their shirt, and basically what I would do is just to remain calm and track the time, as same as a tonic-clonic. And then also just make sure that they're not going into hazards. So if they're heading out into a busy street, if they're headed towards a set of stairs or something like that, then I would just gently guide them away from that hazard. You can sometimes stand in front of them and they'll just sort of walk away on their own. What I would be aware of is that I would not grab a person or try to restrain them when they're in this state, because they probably will try to act out and maybe hurt you because they don't know what is happening. So they could push you, hit you, those sorts of things. So just, you can touch them, but use a gentle voice and use a gentle touch. So So how is somebody diagnosed with epilepsy? Some of you who are on the call or on this webinar may already know this if you have epilepsy yourself or if you've been with someone through this diagnosis process. But basically, you would go to the doctor. You would probably want to find a neurologist or even an epileptologist. Epileptologists are people who specialize in epilepsy. They're neurologists who specialize in epilepsy. And the main areas around the Denver metro area or in Colorado that are epilepsy centers would be University Hospital or Swedish Hospital. Those are the two for the adults. And then in adolescents, some adolescents are served there too. And then Children's Hospital is known to be kind of, you know, the epilepsy center for children in the state. There are some epileptologists and neurologists that are quite good and know a lot about epilepsy that are in other areas of the state or even in Denver Metro, not at those hospitals, but those are kind of the main, you know, 3 clinics, I guess. And one of the tests that they'll probably do on someone who they think that epilepsy might be happening is an EEG. So they might do an MRI and some of the other tests too, but the EEG is kind of the more commonly used diagnostic tool. And, you know, what to tell your doctor about seizures, this is a really good topic that we could go into extensively, and I won't go into it all that extensively here, but you know, you really want to tell your the doctor the symptoms that you're having in as much accuracy as you can. And I would keep some sort of record or some sort of seizure log for you, your child, or anybody that you're close to. Help them, encourage them to keep some sort of seizure log. You know, by the time, a lot of times you don't see your neurologist for who knows how long, a month, maybe longer, maybe every 6 months. And by then you're going to forget what exactly happened, maybe what was happening before the seizure, what happened during the seizure, what happened after the seizure. So the doctor can really benefit from knowing all of those nuances about your seizures, and that can help them, you know, try to find the best medication possible or the best solution possible if they can know all of those sort of patterns and nuances of your particular seizure. So definitely keep a log, write it down. You just get as much detail as you can about what happened during your seizures. We encourage people in schools to use seizure observation logs, and those are on the epilepsyfoundation.org, and I believe it might be on our website too, epilepsycolorado.org. But they are actual sheets of paper that have specifics about a seizure, and then you just check what had happened. So it's just kind of nice to use something like that because sometimes you won't be thinking about it, and you might not realize that, oh, they fell on their right side, you know, and oh, that might be important rather than falling to their left side. So those are useful tools. And the treatment goals in epilepsy have really, I think, come to sort of a middle ground. I think that years ago, the treatment goals were to have people with epilepsy eliminate their seizures. That was kind of the goal. And of course, that's always going to be the goal, but if that's not able to happen in a, I guess, in a great way, then the doctors are really looking at how can we help this person lead a full life, you know? And so if they have to lessen the medication so they're not, you know, in a comatose state and can't even function in life, you know, that's not good if they're not functioning very well in life, but they're also not having seizures. So maybe lessening those medications, and maybe somebody does have periodic seizures, but they're able to live a full life and, you know, have their memory and be able to interact with other people during the process. That would be kind of the best of both worlds. So